Today we are doing a non-surgical gynecomastia reduction, or a non-surgical reduction of excess male breast tissue. Our amazing patient's already had one session. We're doing our next one. So what we're going to do is, he's definitely smaller than last time, and we're going to focus on this area and this area to do a reduction. Now when you do this procedure, it needs multiple treatments. It's not just one, but the effects are permanent once the fat shrinks and we shrink the gland. We're using deoxycholic acid to melt it. We're going to do a series of injections. We're doing 3 syringes of deoxy per side. Let's do it. You ready?
Yes.
Did you have a lot of swelling last time?
No, not really. I was a little bit of bruising on this side, just a little spot.
Okay.
And it went away after a few days.
Very good. Ready?
Yep.
So your last session, we did 2 syringes per side. Today, what we are doing is we're doing 3, okay?
All right.
That's 3, correct? Okay, good. Normally, back in the day, the only option was surgery. Now we have other options. We can do a non-surgical chemical reduction of this by melting the fatty tissue and some of the glandular tissue. We're using a medicine that's off-label. What that means is this medicine is not FDA approved for the chest. Our patient knows that, he's okay with it. We're using it off-label. What that means is we're using it in an area where it's not approved. The medicine doesn't mean the medicine is not FDA approved, but it's just not approved for this area per se. You got to go slow. You can't start with too high of a dose. You start with a little bit, you see how the person does, and you give them whatever's needed. And you slowly increase it. You get in trouble and you cause indentations and tissue necrosis if you do too much. You have to do enough where the patient feels there's a result, but not too much where you get a problem. It's a balance. How'd that feel?
Really well.
It hurt a lot?
No, it didn't.
All right, thank you.
She did a good job with the numbing.
Yeah, she's really good.